The impact of animal health on a dairy goat herd is important in that it can mean the difference of a very healthy to a not so healthy herd and everything in between. A healthy veterinary-client relationship is key to a healthy herd. Successful and profitable dairy goat herds tend to have a good relationship with their nutritionists and veterinarians, as the nutrition and herd health tend to go hand in hand. The goal of this module is to help goat producers understand the importance of the veterinary-client-patient relationship. VCPR stands for Veterinarian-Client-Patient Relationship. It is a written agreement and formal relationship that identifies the veterinarian who knows you and your farm well enough to provide guidance and treatment of your animals. A VCPR builds a trusting relationship between the herd owner and veterinarian with the best interest of the herd and the business in mind. It is required to obtain prescription medications and extra label use of drugs. It also allows for in-depth knowledge and expertise around animal health, biosecurity, and can be beneficial in troubleshooting issues on the farm. You can think of a VCPR like a primary family doctor, a doctor who you consult with regarding prescription needs, changes in health status, or specialized services. An overall goal of this relationship is to prevent health issues before they occur, rather than simply reacting to concerns when they occur. Your role as herd owner in a VCPR is to have active communication with the veterinarian so they know of any health changes to the herd, allowing them to diagnose and make a treatment plan based on your farm's history and animal health. It's important that you ask questions to make sure you understand health treatment plans and that you follow through with your veterinarian's instructions. Keeping records of animal health is also very important to the care of the animals, as well as helping in discussions you may have with your veterinarian. Good records help the veterinarian understand patterns of health incidences that might otherwise go unnoticed without proper records. The veterinarian's role is to help build a customized agreement that reflects how you will communicate with each other. Once this is established, then treatment protocols and animal health plans can be developed for farm-specific conditions. The veterinarian will diagnose and treat animals based on clinical judgment, provide medical care and oversight of treatment, as well as assist in maintaining health records for your animals. This type of agreement becomes quite valuable to you as the herd owner in managing and identifying ways to improve animal health. Many veterinarians offer a wide range of additional services that can add value or save costs for your dairy goat operation. There are many troubleshooting issues they can play a vital role in. For example, milk quality troubleshooting, records analysis, nutrition consulting, standard operating procedures, and many more. Even though veterinary visits for a sick doe might cost more than the value of the doe itself, other herd health data or advice during visits can be of value. Again, a sort of a preventative medicine from the incidents happening again. Veterinarians can help protect the farm against certain risks like disease outbreaks or death loss by building and implementing a herd health plan specific to your farm. The first step to establishing a VCPR is to find a local veterinarian that you would like to work with and contact them directly. They can assist you with the process and can help determine protocols for your farm that allow you to have antibiotics on hand for treatment. Finding a veterinarian with expertise in dairy goats might be limited. However, there are many opportunities and resources for veterinarians to build their goat knowledge, and they can always reach out to extension services for assistance and resource information. To maintain a VCPR, a routine in-person visit to monitor and examine animal health is required, along with regular communication as determined by the veterinarian. If the veterinarian does not see your livestock on a regular basis, the VCPR is no longer valid, and it would be illegal and unethical for your veterinarian to prescribe medications or recommend treatment without having any recent interaction with your animals. Your veterinarian should be familiar with your animal's medical history and keep a written record of your animal's health so they can provide you with your animal with the best possible care. For more information on establishing a valid client-patient relationship, go to the American Association of Small Ruminant Practitioners, and there you'll find a template to begin building that relationship. Communication is key to this process of establishing a VCPR. First, a signed, written VCPR agreement is important. This helps define what the veterinarian and farm owner are each responsible for and provides awareness of expectations from each. For example, you might expect that each time the veterinarian comes to your farm for herd health, they also walk through the fresh pen or examine recently born kids. And for the veterinarian, they may expect that medications they provide to you are used according to the directions and that treatment records are maintained. This helps to ensure that each person has all the information he or she needs to make the best decision for the animals. The customized plan should provide information on how animal health will be communicated to the team and how regular communication will occur. This could include team meetings, herd health, how often communication should happen, as well as other types of communication. We want to avoid habits that violate a VCPR relationship, such as sharing of medications. There may be a habit among producers to borrow medications from other producers. And I think it's important to highlight that even if you think you're just helping a neighbor, this is inappropriate and it does violate the VCPR relationship with your veterinarian. Veterinarians are best equipped to manage the risk of using medications to treat animals on the farm. These products are very important for restoring and maintaining animal health, but their use also exposes the farm to risk. Numerous regulations restrict the use of medications on farms, and veterinarians are experts on how to use medications safely and effectively. Additionally, veterinarians can help farms write treatment protocols that protect against residue violations or other food safety risks. As a dairy goat producer, you know the responsibility, but also the satisfaction of providing quality products to our consumers. A VCPR ultimately helps to maintain a high level of animal care while continuing to grow consumer confidence in the products they are consuming. Thanks for viewing this module. If you would like more information on establishing a VCPR, please reach out to your local livestock extension specialist. The FDA has also provided several resources around this subject, including frequently asked questions and antibiotic stewardship in veterinary medicine.